Perfect. Okay, everybody, welcome to the USMLE Step 2 Comlex Level 2 workshop presented by the AMWPA Mentoring Committee. Just for everyone that is in the chat now, if you are not a presenter, panelist, then please stay muted. If you have any questions, go ahead and drop them in the chat. And then we have a Q&A portion of this workshop that will come a little bit later. I'm going to go ahead and start sharing my screen. There we go. All right, can everybody see? Good. All right, so just to start with the prayer, here is Surah Al-Fatiha. So without further ado, and please excuse my pronunciation if it's not the best. Bismillah ar-Rahman ar-Rahim. Alhamdulillah Rabbil Alameen. Ar-Rahman ar-Rahim. Malik Yawm ad-Din. إياك نعبد وإياك نستعين. اهدنا الصراط المستقيم. صراط الذين أنعمت عليهم غير المغضوب عليهم ولا الضالين. Ameen. And I actually say this before I start every single exam I've taken since middle school. And I can say that I think this is part of the reason why I don't have as bad test anxiety, because at the end of the day, like, you do everything you can and then you give it to God. And I think that's a good mentality to go into boards, to go into any exam or any scary experience. All right, introducing. My name is Stephanie Elbanna. I'm an MS3 at TCOM. And then our panelists, if you guys want to introduce yourselves.
Hi, I'm Aiaza. I'm an MS3 at Dell.
Hi, I'm Sareena, and I'm an MS4 at TCOM.
Salam, I'm Bisma, and I'm an MS4 at UTMB.
Hi, I'm Sundus, and I'm a PGY1 at Medical City Arlington.
Okay, and without further ado, we will begin our questions. And for our panelists, if you guys, as we talked about before, if you have something that you believe is worthwhile to say, some advice, feel free to jump in. So first off, how did you study during your rotations? And just for audience knowledge, for some people that begins in second year, for some that begins in third year. So just in general, how did you approach studying for shelf exams?
I can start this one. So for shelf exams, typically the day before my rotation would start, depending on what it was, peds, family medicine, OMM, whatever we had to do. I used UWorld as my main study resource. So I used to go and I would go into UWorld, see how many questions fell under that rotation or that subject, and I would divide that by the number of days in the rotation. And I always subtracted about a week. So my goal was to try to finish all of the questions like a first pass with like a week before my COMAT was supposed to happen. So I divide that. So for example, for pediatrics, our school does a 4-week rotation. So I would divide like the UWorld questions by 21 and try to finish them in the first 3 weeks of the rotation. And then I would spend my 4th week just reviewing my incorrects. And I was a big fan of UWorld flashcards. So I used to make flashcards with all the tables. So it's like kind of a quick review. You can use them on your phone when you're sitting in between patients in the clinic or something. But I'd have those flashcards available through UWorld. I'm not a huge Anki person, so just having them on UWorld was nice. In UWorld, you can set it up like Anki if that's something you do like. So that was my main study strategy for rotations.
Awesome. Anyone else?
I just second that, like, UWorld is doing the amount of questions is your best bet, and like actually understanding. It's very slow in the beginning, so it's going to take a lot longer to review the questions, but you're learning the material, and then it goes a lot faster. So it can be very daunting if you see 600 or 1,200 questions, but it goes by really fast after the first round of questions. And then for us, we have shelves exams that we have to take. And there are old shelf exams to take, and you must always use the NVMe material, especially in the last week leading up to the exam. You should be relying heavily on the NVMe materials. They're repeat questions, and they test concepts very similarly.
And one thing I'll add with shelf exams, I think was kind of like a good catalyst for me. And like I noticed whenever I started doing this, which wasn't until my second rotation, but like I had like a boost in my scores, is that I would do a content review in the first week. Like I would still be doing my UWorld, but I would also watch some high yield videos that a lot of people watch right before the shelf. But I found that doing a first pass in the first week and then doing a second pass of those videos right before the exam was kind of the best way for me. And I'll be sharing those videos later on in the presentation. But there's 3 specific high yield sources, and they have some more resources like on their pages. But there's 3 high yield videos that comes out to about like usually around 6 hours worth of video for each shelf, but definitely worth it.
I can sort of jump in. So I'm sort of remembering my MS3 year, and I think what a lot of upperclassmen told me was to watch like OME, online med ed videos. Those were kind of hit or miss for me. I didn't really like them for thorough content review. Also didn't really like the presenter's style, but I feel like a lot of people were torn in 3rd year because it was like, do I just do the questions without knowing the material and then learn with the questions? Or do I watch like a lecture or a video on YouTube or listen to a podcast to sort of prime your mind for the material and then do the questions? So it's whatever works for you, but there's a lot of overlap between shelf study material and step 2 study material. So it's going to benefit you either way.
And tying on to what Bisma and Stephanie have said about like videos and everything, don't be alarmed if you have to change how you're studying per rotation. For example, online med ed, I liked it for OB, and that was probably the only like topic I ended up using it for. Whereas like there are other videos out there like Emma Holiday is great for pediatrics or like divine intervention for internal medicine. So don't like be stuck that I have to watch all of the online med ed videos for every rotation, or I can only do divine intervention. Like there are other resources out there. And some subjects, like if you were strong in gyne, you might not like during 2nd year, you might not need to like do a content review at the start of the rotation. So just kind of be more flexible with your study schedule. It doesn't have to be the same thing for every rotation.
And then I just wanted to add something. Looking back, I'm a intern this year, so it's been a little bit removed for me. But one thing I would also suggest that's also really helpful in residency is just during your rotations, just like look things up. Even if you don't have time to, maybe that day like look up a video, but if you, use like AMBOSS or something, like some kind of medical library, any kind that you like, and look up a topic and just read about it. And over time, when you like repeatedly look things up, it's going to stick for you. And then another thing that I used as a 3rd year, if for some reason, like, you don't have time for like to watch, like online med ed or like boards and beyond, like a series of videos. There's this one guy on YouTube, his name's Dr. High Yield. He does like hour to hour and a half long like videos over like an area. And sometimes what I would do is like watch those like the night before, like a week before or something, just to like refresh. And I found a lot of the stuff that he brought up would come up in the shelf exams. So that was something I would do sometimes if like, if for some reason you couldn't get through all the videos or you feel like it's too overwhelming to do videos and questions.
And also one thing like this is another thing that I kind of struggle with videos is because I'm not an audio learner. And like even though there's like PowerPoint built into Emma Holiday and like kind of PowerPoint built into Divine Intervention, and then Dr. High Yield, he has some slides that have pictures. One thing that helped me is to actually like, and this does take more time, but to listen to it at regular pace, not 2 times speed, and to kind of rephrase what they're saying in the form of a question. And then, so I did that during my content review the first week. And then I used those as my own flashcards that I would then use the week before. And like just for Dr. High Yield, Emma Holiday, Divine Intervention for Peds, I'd say about 90% of my exam that I took yesterday was covered by those 3 videos. So I cannot stress enough how helpful they were. Obviously, you still need to get used to the type, like how to answer questions, like how to approach questions in a short period of time, because you don't have that much time per question during a shelf exam or during boards. So do practice to build stamina. And also UWorld is a good learning resource. But if you really want to memorize and understand, I'd say that, at least for me, like I needed a way to kind of write things out and rephrase things in my brain so that it would stick for a long period of time. Alrighty, let's go ahead and go to next. And then now specifically for dedicated study for step 2 COMLEX level 2, how did you guys build a schedule?
Personally, I thought it was harder to build a schedule for step 2 compared to step 1. I think step 1 was easier to build a schedule because you kind of knew like what your subjects were, breaking it down by organ system. Step 2 was a little bit harder because a lot of the like material overlaps. Like a lot of what you'll see in family medicine will be covered in peds, or a lot of surgeries covered by IM. So it was a little bit more difficult. My schedule was more, I knew I wanted to take a practice exam every 5 days. So I scheduled that originally as like how often I'd be taking practice exams. And then in the middle, I would just kind of make it, just do random questions. At this point, I had reset my UWorld. So I already made my first pass through my rotation. So I'd reset UWorld. And it was my goal because as Aiaza had said, that as you do more UWorld throughout your COMAT and everything, it goes there.
Thanks for checking. Okay, we'll try again in a minute or two, right? Okay.
So by the time you get to dedicated UWorld, it's also going faster. So I found myself being able to do more questions than I could do during my step 1 dedicated. Like we try to do 60 to 80 questions a day during step 1 dedicated. I was able to do closer to 100, 120, depending on how the questions were going that day. So mine was mainly try to do as many questions as I can during the day. And I kind of had a hard cutoff for about 4 to 5 p.m. And then after that, and until about dinner at 7, I would watch videos, whether it be divine interventions. I could rewatch those during dedicated, some random sketchy videos, or if you find a topic you're missing, like for one example for me was toxicology was something that was always hard for me, all the different like drugs of abuse, like identifying all the different ones when you get a patient presentation. So I would watch like a video for that if that was
Well,
like.
I'm glad you're
a lot of
checking and you're doing it yourself. I'm proud of you.
Whoever's for all people that
please.
are for
I'll see
everyone
get
else
tickles
that
back,
is here,
so.
you can please mute yourself. Oh, I see. All right. Let's go mute that. All right, and let's continue.
Yeah, but overall, though, making a schedule for dedicated was like step 2 was more just like trying to get through as many questions as you can and review topics you had missed, not so much, oh, I'm going to hit like all of my endocrinology questions, because just the way step 2 is designed, it's more clinical. So it's harder to like break that down into set schedules. At least it was for me. So mine was just do as many questions as I can, then take 2 to 3 hours a day to review videos to brush up on topics I was missing or I had on my like list of topics I need to review before for step 2, and then take a practice exam every 5 days.
Okay.
I think it really helps, like Sareena was saying, like to keep it flexible and adaptable. Like obviously you're gonna try to have goals or checkpoints, like a practice exam every week, or you're gonna like sort of review an exam or whatever. But I found that so I had a very flexible approach. I tried to like not overwhelm myself with like there's going to be people who are like I have to hit a certain number of questions every day, and if I don't I'm going to feel terrible. I feel like you have to sort of do practice tests, sort of gauge where you're at, figure out what you need to work more on, do a more thorough content review with that, and then things you're stronger with you can do some questions, try to space it out with dedicated question blocks on a certain, like I'm going to do peds, I'm going to do OB-GYN, and then do like a mixed one, peds and OB-GYN, or all of them. So I think, like, don't get me wrong, because this was a mistake that I made. I was a little too flexible in the beginning, and then that kind of bit me in the butt. But, like, try to do as many questions as you can. People are going to tell you all sorts of things. I think at least around 70% of the questions you should be fine, because they're adding questions all the time. I'm sorry, if someone tells you to do, like, all 4,000, 5,000 questions, I think that's insane, and dedicated. Try to do as much as you can, but the more you will, the better you will do.
Yeah, I just wanted to echo what they said. So, for everyone, it's kind of different what they're comfortable with. My recommendation before dedicated, try your best to complete like one question bank as much as you can. It doesn't have to be like 100%. And, if you're a DO and you decide to do like a more DO focused question bank, that's fine. But kind of what both of them are saying, that, focusing on doing as many questions as you can, because step 2 and like level 2 is focused more on clinical vignettes and applying that. So that would be one thing I think, trying, during your rotation, like they were saying before, getting through as many questions as you can so that when it comes to dedicated, and if you decide to go back and like do your incorrects or you try to go back and reset it, not everything you're going to be seeing for the first time. The other thing I would that I did that I found was helpful was in the beginning of my dedicated period, I took a practice exam to see what my weakest areas were and where my strengths were. And I started off with my weakest areas and kind of worked my way down. Because like they were saying, step two, there's a lot of overlapping information. It's, you kind of have to be more flexible. But I think, kind of focusing on where you're weakest first would be more helpful. And then definitely for level two, like as a DO, don't forget about OMM. So make sure, like, if you decide to do like UWorld, like make sure you still do OMM questions because, I don't know. I heard from some people like, oh, like there's not as much OMM on level two, but that's not true. And a lot of the times, I'm not saying it's easy, but it could be easier points for you. And I know like we talked about like YouTube videos, but one that I had used for like OMM, especially before level two was Dirty USMLE. He has like really good OMM, just like quick review. But that's kind of how like I had structured my dedicated.
Alrighty, next up. And so I guess we kind of already touched on this, the examples of schedules. So we'll go ahead and keep going.
I just also want to add, because this what Sundus was saying reminded me that like everyone's going to have their own pace of doing things. Like for me, reviewing an entire practice exam would take multiple days. But it's because I was going into depth into every question I was getting wrong and sort of relearning that material. So don't get too hard. Don't basically try to become a robot and like stick to a rigid schedule. Like be flexible and adaptable. Take a diagnostic test in the beginning, see which subjects you're not as great at, and then keep taking practice tests as checkpoints to see where you're improving and where you're not really improving.
Alrighty. So these are some of the top resources that you guys mentioned. If you guys want to just talk a little bit more about each of these.
I think I put a lot of this information on, so we already touched on UWorld, it's the Holy Grail. I thought AMBUS was a lot better for ethics questions than UWorld. I found this thread on Reddit, and the second comment has a bunch of different linked out threads of questions that you can do. I highly recommend doing those, prioritizing them if you're not doing any other AMBUS. Melman Medical has these free PDFs. Do not watch any of his videos. He's a really weird person, but his free stuff is really good. I had completely forgotten about biostats, so his biostats packet helped me a lot. I recommend that one. I'm gonna clear my throat real quick. Excuse me. So yeah, that's the free stuff. Don't watch his videos. And then the NBME exams, again, these people are making the exams, so you should definitely be doing theirs. You can take a few offline to save some money, but I definitely recommend getting at least 3 online so you can get the detailed report. I really, like Bisma, I also took a lot of time reviewing my exams because that's where you can really pick up on your weaknesses and target those. So with the detailed reports, it actually tells you areas of focus and what you can, like the specific areas that you need to be improving on. So I found those very helpful. It also gives you an exact score, so you're not using online score predictors and stuff like that. So it's worth the investment. And then for some free PDFs of the test, I have it linked down there. A lot of my friends use that. They didn't get any viruses or anything on their computer, so you can use that link. They also have free shelf exams on there too if you're trying to study for your rotations.
Perfect.
It was
Next.
mentioned before, but trying to diversify which method you're using for which subject really helped me. And that's just like the way my brain is wired. Like I'm audio, visual, and tactile learner. You might be more focused towards visual, but just like trying to engage with your head, because after like days of just doing questions, like your brain just get like rots. Like I can't do it anymore. So I try to like watch a lecture or like listen to a podcast and constantly try to do like active recall just to keep the brain muscle memory going. And so like in addition to UWorld, everyone mentioned Divine Intervention. So that's a podcast. You just put it on in the car, answer the questions along with him. It's a good way to jog your memory. Emma Holiday, she has the good lectures. Some people do say that she has some errors in her videos, but you can look that up and people have written them down. But she's really good. Dr. High Yield was also mentioned. He's really good. Just listening to him, answering the questions he's saying, like pausing it and then seeing if you were right. Also, I found another guy on YouTube, Dr. Tim. You spell out doctor and it's Tim. He does like these really focused lecture videos on like cardiology or like GI. So I really found those helpful as well.
Cool. And then I'll find that and I'll link it here before we share the presentation. Thank you for sharing that one. Okay. How did you balance your time during studying? So this is more like mental health, family time. Like, how did you find a balance?
Yeah, I think definitely board studying is like, it's not just like, knowledge, but it really tests like your everything, especially because, you're so like zoned in and like all these weeks you're studying. But I definitely think please have like at least an hour to yourself, at night or something or whatever, if there's certain things that you like to do, like if you like to work out, even if it's not as intensely as you can usually do it, just, do it for your own sake. Everyone's situation is different. I'm married, so like for me, like having dinner with my husband and, like watching TV or something like that was really important. So I didn't sacrifice that. And then, trying like once a week to do something that's not, I don't know, like just going out or spending time with family or something for your mental health. But as a resident, I can say, not that I'm saying these exams are not important, but I think that we as medical students, we think, oh, like this exam is my whole entire future. And I think the more that you tell yourself, like, this is basically a stepping stone to get to one thing, and then that's all it is. Like in residency, no one cares about your board scores. No one's ever asked me about my board score. Like, I think just just because of the situation you're in and applying for residency and how stressful the whole process is, we kind of, freak ourselves out. I definitely did that. But looking back, I think that just the more that you tell yourself that, or the less weight that you put on this exam, the better it's going to be for your mental health, which is much easier said than done. But looking back, that's what I would say.
Also, it's just a rehash of the entire year that you've been doing, right? The clinicals. So you've passed all your rotations, you've done all the shelves. Now it's just a culmination of it. And like you already demonstrated that you could do it. Just like it was a very big thing that I had to struggle with, but it just comes down to try to stay grounded. It's okay. Like you got the material. You just need to know enough to just do well. You don't need to know everything. No one's asking you to know everything. And then do the best that you can do and just leave it up to God.
And one thing I did want to mention that we're working on right now as a program, and this is for boards, but also just for studying in general while in medical school. And also we'll open it up. We'll have an undergrad division too, is what we're going to call chai chats, where in the evening each day, or maybe like once a week, we'll have like a 4-hour Zoom where anybody can join at any time they want. You can come in and we can talk at the beginning of the chat and say like, oh, this is going to be a study chat. We're all going to be quiet. And then people can message me like, is it okay if I talk to someone? Basically, it'll be like a little mental health group, a little support group. And that'll be like for boards or for studying for finals, anything like that, where people across, space, people from different states, different schools, from different parts of this journey, medical student, undergrad, can kind of meet together and not feel so alone. So I know a lot of people struggle with that. So there'll be more information coming about that soon. And you just make yourself a cup of chai and join the chat. All right, next up. What other advice do you have?
So we got a question in the chat. I guess I could just address it here. So I thought your scores in USMLE 2 count a lot for residency programs. You have to get high scores. So in a sense, yes, it's a numerical way for them to sort of look at your application, but also my score barely came up during my interviews, and it was mostly about my personal statement, my letters of recommendation, and the extracurriculars I dedicated myself to. Now, I'm doing family medicine, so obviously that's different. The score is important, but it's not like Sundus was saying, it's not black and white, like, oh, your entire career is ruined because you didn't hit a certain benchmark. It's like they're looking at you as a person, and holistically, they might use the number to sort of weed you out, but it's not as clear cut as people make it out to be.
Echoing what Bisma said, I applied internal medicine this year, and on my interview track, I never got asked about my scores, what exams. As a DO student, I only took the complex exam. I never got asked, why did you only take one and not the others? Things like that. And honestly, when you're searching for residency programs, when I looked last year, I think during my second year, I was like shocked, like all the programs had like their step 2 scores listed, that we want this number. But then looking back last year, as I was getting ready to like make my final list of programs to apply to, a lot of schools had like removed that information from Residency Explorer, like kind of indicating that they are looking more in that holistic view. All of my questions were about my volunteer work, as well as just what I wrote in my personal statement. No one once asked me how many times I made honors in a class or what percentile my step 2 score came into. Like, that was not a huge consideration on the interview trail.
I just
But
want to add a little bit of a different perspective. I haven't applied yet, but my school stresses a little bit more on the scores. It depends on your specialty. So I have friends applying diagnostic and interventional radiology. They have to hit 250 plus. That's just like their benchmark and looking at like this year's match results. So if you're going for a more competitive specialty, I think that's where it plays in. It's more nuanced. I think because they have so many applicants, they have to screen you a little bit, but it's kind of like the screening thing for those very competitive specialties. I think in general, the advice my school gave us was look at the specialty you want to apply to, and you should be in that ballpark average, if not higher, end of your step 2 score.
And that's also a reason why a lot of people dual apply.
Yeah. So yeah, I just wanted to clarify what I was, you guys basically got what I was trying to say, but just for everyone else, like I'm not saying that the score is not important. It's obviously very important, but I think as, as medical students or when you're in it, if you tell yourself that like my entire life depends on this exam and you give yourself all that anxiety, like it's unnecessary anxiety is what I'm saying. We all know this exam is important and everyone knows that you need to study as hard as possible and score as hard as possible. And as Aiaza was saying, like obviously it's very specialty dependent. Like if you're applying something extremely competitive, then obviously you want to make a certain, benchmark score, or any specialty really, you want to make sure you're in the benchmark. But what I was trying to say is like, I think sometimes as medical students, we have this mentality that this is like my determining factor for my life. And I just don't think that's very healthy. And it's just going to give you unnecessary anxiety. Just like Bisma said, do your absolute best, do everything that you can, and then leave it up to God and make dua for whatever's best. Yeah, that was kind of like what the mentality I was trying to get at.
I think that's like the right way to think about it, because I, for the first time, had so much testing anxiety that I couldn't like read. When I was reading questions, I just had this nagging voice in the back of my head telling me like my entire future is dependent on this, and I've never felt that before. So I actually got a prescription for propranolol from my PCP. I took 10 milligrams and my score went up 10 points because I was finally able to shut all the other noise down and just focus on the exam. I'm a big advocate for propranolol and beta blockers. If your health allows you to take them, I would recommend that you talk to your physician, your own PCP with that. If that's something that works for you. I had a lot of friends who were struggling with something similar, and we all decided to pull the plug and take this. did not want to take any other medication, and it definitely, I saw like a major score improvement. So if you're really struggling, there are things that are there to help you. It's literally for performance anxiety, which is what I was struggling with. It's a relatively benign medication, but talk to your doctor.
Thank you
Awesome.
for sharing that, Aiaza. I'm on an SSRI. Like, I'll tell everyone, like, anxiety is a real thing. I think also another thing, and maybe it's just me, the exam is so freaking long that like after a certain point, like I just don't care. Like it beats the anxiety out of you. Like I'm just like I'm so bored. Like, and I'm just like doing the questions. So like I was just banking on that. I was like, I know the first few blocks I'm gonna be really anxious, but it's gonna be so boring sitting in that stupid room with a white noise machine. Like, I just don't care. I'm just gonna do my best. I've studied my entire life for this, like, whatever.
I felt
What-
that the caffeine and the beta blocker like working against each other.
One thing, this is just something that I do to with standardized exams, just also to kind of kill the anxiety, is I pretend it's something else. So I don't know if anyone ever played Trivia Crack before. It was that one game that kind of went viral for a little while. I pretend that every exam I take is just me playing Trivia Crack, and I just do my best. This way I don't feel the weight of the exam as much.
I've also heard pretend that it's excitement. Like, I'm so excited that I'm one step closer to being a resident, you know?
Cool. I like that one. Alrighty. Next, questions from the audience. I'm gonna go ahead and jump back over here. Take a look. I'm gonna stop sharing. Let's see what we have in the chat. And I did also want to add one thing. I know that we said like scoring is specialty specific, but I also want to plug that it's also specific program, like by specific program. Like for me, like I was told because I really wanted to, I'm dual applying FM and IM, predominantly IM, but one of my top programs is JPS Family Medicine and UT Southwestern Family Medicine. And I actually was able to talk to a good amount of the interns, second year and third year residents. And I, from two separate sources, I was told that the the incoming class, there's not a single person that like of the incoming class that has had a below 250 step 2 score. So also be mindful that even if it's family medicine, some programs are extremely competitive for a good reason because they're very rigorous, but look into your programs, Residency Explorer, do that as a second year. I was grateful that I did that before I started third year because that kind of helped me shape my study schedule too. I was like, okay, I need to hit the gas a little bit more. So yeah, do your homework ahead of time so you don't get shocked later.
I think it's like a counterweight. I think that's a good way to think of it, like a balance sort of thing where like your step 2 score does hold a lot of weight, but even if you don't do as amazing as you wanted to, other things in your application can sort of lift you up. Like if you're a president or something, or like you've researched a lot of papers or anything. So it's like, don't think it's the end of the world if you don't quite hit the benchmark. You can still try. I think that's what we were mostly trying to get at.
Yeah, and another thing, just like looking back at the process now, what Stephanie was saying, and I know Dr. Hannah like really emphasizes this too, is networking. So what we have here in this group, like there's so many resources, so like there's so many physicians that you have access to, but really like if there's a program that you're very interested in, please try to reach out to like current residents, or like if there's any way you can get in touch with faculty, because that like personal connection, it goes a very long way. I'm not saying it's gonna like obviously everything matters, like your scores, your grades, and your extracurriculars. But if you know like there's like these 2-3 programs you're really interested in, or if there's like a specific area of medicine that's like more competitive that you're interested in, like really try to network as much as you can, especially through this organization that we have. I've really seen it like it make a big difference, like for people I know and like in my own personal experience. So
I'm going to go ahead and share screen again for our last resource slide. And then this will get posted. this PowerPoint. So these are just other resources, including YouTube playlists, podcasts, book links, etc. So some of these we talked about already. Emma Holiday. This is kind of a link to a page that has her lectures, the videos, as well as the PowerPoints made into a PDF. And it also has the errata. So like that's the errors that we talked about, which is mostly just because the lectures are pretty old. So like one big thing I noticed was like the recommendations on asthma, very different from when she was there versus what we're tested over now. So this is a good link. These are like kind of the catch-all for divine intervention. So there's a Google sheet with a list of the episodes per clerkship or per topic. So that if you want to like focus on biochem, if you want to focus on peds, it'll tell you which episodes to listen to for the podcast. And then there's a link to the podcast, and then there's the link to the videos specifically for shelf exams. It'll say like divine intervention, pediatrics, divine intervention, internal medicine. And then there's also a very large note document that has notes from all of his lectures, and that's also organized by episode, and there's a really good table of contents for it. This is the link to Dr. Highyield's page, brought him up earlier. And then for OMM board review, this was brought up earlier. This is a really good playlist by Dirty Medicine. So that's kind of everything. And this will all be posted.
I'm just gonna add, I'm just gonna add real quick. Something that helped me was looking directly at the USMLE content breakdown, because I remember being really surprised how much higher neuro was covered on the exam than, so like that also kind of sort of dictated how much I spent on what. Like for example, cardiology is a big chunk of the exam. So if you are weak on it, you need to spend time like doing a thorough content review. So you can find that on the USMLE NBME site. Also, I think Aiaza, you had mentioned like some of the NBME exams you can take offline. Yeah, so try to do the free 120. They literally repeated a question from that exam on my real exam. They'll do that. They'll repeat questions sometimes. So try to do the NBME forms. But that's pretty much it in terms of what I have to add.
I just wanted to say, I know we've like bombarded y'all with a lot of information, and there is a lot of weight on step 2. We don't want to like minimize that. There is that pressure, but just take a breath. The one great thing about step 2 is you've been doing these questions for the whole year. Like it's your COMAT questions and or your shelf questions. And a lot of the topics, it seems scary, like cardiology is scary, but you've seen it so many times, whether in the capacity of surgery, pediatrics, internal medicine, family medicine. It's all there. So just take a breath. You've done it all once if you've studied for the like shelf exam. Now you just got to kind of do it again in a way, just in a shorter amount of time. But at this point, it's kind of just reviewing it. So don't stress out too much. It's not as bad as step 1 was, where you're trying to cover 2 years of medical school in 4 weeks. And it's more like the nitty gritty. Do I understand the physiology and the pathways of glycolysis and gluconeogenesis? This is more like clinical. We're putting you in the hospital. What would your decision be? You've been doing it for a year, so just take a breath and you will be fine.
All right, everybody. Do we have any other questions? Let's take a look at the chat. Do we have to send you our email for the PowerPoint? No, so I will make a public copy of this PowerPoint, and then that will be shared in the big WhatsApp group. And then also it'll be shared in the class group me's. If you're part of your local AMWPA chapter, it'll be posted there as well by your leaders. And then also this entire presentation was recorded, will be posted to the AMWPA YouTube page, and that will also be linked in the chat. So all of these will be sent in the same place where you received the invite to this meeting. So if we don't have any other questions, can I please have a link to the WhatsApp group? Yes. Let me go ahead and, if you can go ahead and direct message me your phone number, I can add you to the WhatsApp group. And actually, let me go ahead and I'm posting my phone number right now in the group chat. If you need to be added, I want you to just send me a quick text message. And then just send me your name, and then I will, so if you want to I just set my phone number in the chat. So just go ahead and text that number with your name, and I will add whoever texts me to the chat.
I also added my info in case anyone's like interested in family medicine or anything.
Perfect. Wonderful. Okay. So if you want to just go ahead and text me, and I'll go ahead and copy your number so I don't lose you. So whoever wants to join, go ahead and text this number. Let me see. Let me go ahead and make sure this goes to the meeting group. 22576. So I'm getting a lot of direct messages. I just sent to the main group chat my cell phone number. So I'm Stephanie. Just go ahead and text me your name. And yeah, I just texted it to the main group. Alrighty, thank you everybody for coming today. Thank you for our amazing panelists, for all of your advice, and for being so honest and forthright with information. We appreciate it. We appreciate you sharing your story.
Thank you. Thank everyone.
Thank you, guys.
And everyone can feel free to go ahead and jump off. I'll stay on for a few more minutes for anyone that's still copying my number. Thank you, everybody. Bye. Alrighty. Go ahead and post this again. Meeting group chat. And if anyone has any further questions, go ahead and text me as well. All right, is it just the three of us? All right, I think. All right, that looks to be about it. All right, perfect. Text messages coming in. All right, thank you, everybody. Have a good day. Bye-bye.